Good morning. This is Michael Gallardini from JRG Advisors. Thank you for joining our webinar. Today's topic is Prepare to Maximize Your Employee Benefits Program, the 4Cs approach. Before we get started, I wanted to provide you with some housekeeping items. If you have any questions, please type your question in the question box and press send. We will answer your questions at the end of the webinar. Within the next few days, we will send you a copy of the PowerPoint presentation, the webinar replay, and the answers to any questions. I want to welcome our valued clients and partners and thank you for participating in today's webinar. The agenda for today's webinar will be Traditional Broker Approach is Broken, 4Cs approach of benefits consulting, which includes cost strategies, creative solutions, consulting, service implementation, compliance, and then once we go through all that, adapting to the change. So what do we mean about traditional broker approach is broken? When you look at today's benefits world and looking into the way that a broker or consultant should be working with an employer group to help you with your benefit strategies, the old way of what I like to call the traditional approach, acting as just an insurance agent, is broken. Just simply, coming to an employer group as an insurance agent, looking at, what is your renewal increase, scrambling through that renewal process to try to get something in place. It just doesn't work for an employer with the changes that have come with the industry today. I term it and usually look at it as a Band-Aid or short-term solution. A Band-Aid or short-term solution, most employer groups that we come across when they have looking at a high renewal increase or their benefits option is just not working for their employees. They're usually a go-to in operating as a normal insurance agent is increasing in deductible or raising co-pays or taking your census and going out to markets and scrambling to find if you can, look at a better cost or a better benefits option for your employees. If an agent does that, what they're doing is they're really putting the employer and tying their hands and putting them into a corner every year when it comes to their benefits program. So how can we be a better broker consultant, getting out of that old way of just being an agent and offering product? The way that a broker should really be looking at an employer group and helping with them is being a proactive broker. Working with a group throughout the year on developing what we'll get into, which is we like to call it JRG Advisors, our 4Cs approach when it comes to operating as a broker. Insurance agents mostly now are being reactive to everything I just said previously. They're reacting to what the market is driving. They're reacting to those high renewal increases. If they're being more proactive throughout the year and really developing a strategy with an employer group, that's when the employer will have a better experience when working with a broker consultant. They'll feel more comfortable throughout the year and working and staying on goal with their strategy. And with the broker being on a proactive basis, they can come to the employer and tell them what's going on before the employer finds out on their own, and then the employer is scrambling to come up with answers. And that's when the employer is calling their agents instead of working as a broker, as a consultant, reaching out and staying in front of everything for that employer group. So the 4Cs approach of benefits consulting. Some might sound corny to some people, but I find when you're talking to an employer group, it really helps keep on pace and to what you're trying to accomplish by just keeping it simple and having everything start with the letter C. And it also really falls into the 4 key categories of what a broker consultant should be doing for an employer group. That first part of the strategy would be looking at cost strategies. Obviously, the most important goal that an employer has every year is maintaining their costs. You know, most of the time previously in that broken process, that operating as an insurance agent, there were no cost strategies. It was reacting to that renewal increase. It was an agent coming to the employer group and saying, what do you want to do? Well, that's not what a broker consultant should be doing. There should be strategies in place to overcome a cost that is not fit for the budget of the employer, and it really should be coming prior to the renewal. Also, we're going to talk about creative solutions, and I'll get into more detail with that. Consulting and service implementation, and compliance review and plan. Those really are the 4 categories that I have found and JRG Advisors has found when working with employer groups that will come to a better result than operating in the old way of an insurance agent. We included in the presentation today, it might be hard to see if you wanted to read the whole article. It's an article that I did on the 4 C's approach for the Smart Business Pittsburgh magazine. And if you have interest in reading that article in more detail, you can go to www.sbn.com to access that full article. We also provide it to some of our employer groups when we're working with them when we talk about this strategy. So getting into cost strategies, what I think most employers have on their mind when they're meeting with their broker, when they're talking about what's coming up with their benefits and what can they afford, what can an employer budget to be on pace to keep on track what they're doing with the rest of their business expenses. One of the largest expenses that an employer has is the benefits that they offer to their employees. When a broker consultant is operating in the right way, you really have to sit down and talk about what the goals of the employer has when it comes to those costs, those strategies that come with the cost of the benefits program. But it's not just stopping there. Employer goals also should really look into, which we have here at the bottom of the slide, of not just a one-year solution. And that really goes back to that first slide in talking about Band-Aid solutions. That's what most brokers or insurance agents have been doing, is offering a Band-Aid solution, solving that one-year increase. What we should be looking at as a broker for our employer group is developing, I think, at a minimum of a 3-year budget strategy. A Band-Aid solution of just decreasing deductible or co-pays, that's only going to solve 1 year. You really have to look into what is the employer looking to offer their employees as far as a benefits program. How can we look into different strategies as far as products, different creative solutions that will meet those needs of the benefits they're looking to offer, keeping in mind of the cost. And then we also have to look at the employee needs. Some brokers will come in and talk about putting in a very high deductible plan, for example. Well, if your employees are making an hourly wage that doesn't support a high deductible plan when they become sick or injured, that strategy may work for the employer as far as lowering that cost, that premium cost that they have on a monthly or yearly basis. But if the employee is injured or sick and has to afford and looking at this high deductible, this high out-of-pocket cost, the employer is just going to hear about it. It's really not going to solve a goal of offering a complete benefits package to your employees if the product is not a fit for those employees. It's a deeper dive and looking at employee needs. As a broker, we can look into offering a risk analysis, even down to smaller groups. At JRG Advisors, we are able to really dig further into looking at what is really driving the cost of my benefits program. Where are my employees at with their health? How are they using the plan? Are they going to specialists? Are they going and having diagnostics done on a yearly basis? So there's a number of ways to do that. The old way of doing it, I think some of us on the call today on the webinar will remember medical underwriting questionnaires. Those still exist. Sometimes that's a fit, but a lot of times, does the employer have the access to get the employees to fill out those medical questionnaires? Well, there are software systems out there that can provide predictive modeling where you can simply just take a census and put it into the software program, and that program will tell an employer, based on that census data, what type of risk they have with their employee populations. It gives us as a broker to have a stronger conversation, not only with the employer, but also going back to the insurance companies when we're looking for products to put in place for your benefits program. If you're not doing a risk analysis, I feel as a broker, you're really not doing a service to that employer group. The risk is what drives the cost of a benefits package, the cost of a health insurance premium. The more use, the more claims utilization that your employees have, that's where your costs are going to go up. So as we get further into the webinar, when we get into really the consulting and the service implementation of what a broker should be doing, there are ways to look into mitigating that risk with your employees. There are programs we can put in place to better drive the health of your employees, which in turn will bring down that premium cost. So the risk analysis is definitely key in the process of looking at that cost strategy and developing what the employer is looking for their goals. When developing a 3-year budget plan, I know some people look at that and say, how do we do that? Well, there's a number of ways we can do that, and that really takes us into the creative solutions part of the 4C strategy. The old way of, and I keep going back to this, of the Band-Aid solutions, the one year, okay, you know, we got through this year's renewal, you know, we got somewhere close to where we were looking for our renewal increase. What happens in year 2? What happens in year 3? That's really, as a broker consultant at JRG Advisors, we have to take a look at different ways of providing a benefits program to an employer to get at that budget goal and get at the goals of the employer and the needs of those employees that utilize the benefits package. Something that's not new but is becoming more popular really came out when we were looking at, and I believe in 2008, of healthcare reform coming into place. JRG Advisors was one of the first brokers in the tri-state area of Pennsylvania, West Virginia, and Ohio to bring an exchange platform or a defined contribution strategy. The defined contribution strategy goes back, way back, you know, to what people sometimes refer to as a cafeteria plan. But I don't want to get into too much detail with these strategies, but I think it's important to touch on what they mean. So really quickly looking at these, at a defined contribution strategy, what you're essentially doing is a number of things on the employer side and also on the employee side of offering benefits. First, on the employer side, it takes away that pain of deciding on what benefit plan, or maybe 2 or 3 benefit plans, should I be offering to my employees. Defined contribution now looks at you as the employer, your benefit to your employees becomes your employer contribution, the money that you provide to the employees to purchase benefits. What we like to do to simplify that process is we look at the monthly contribution, and most of the time what employers are doing is they're doing a percentage of premium. We can still do that type of process, but we break it down to make it easy for employees to understand into a flat dollar contribution. So working with the employer as your broker, we decide on what is your budget, looking at the first year and really going out in year 2 and year 3 to what we can look at of offering on a dollar contribution on a monthly basis to your employees to purchase benefits. What we then do, where it comes into the exchange platform part of it, is we offer a menu of products for your employees to choose from to select the correct benefits for themselves and then any dependents that they might have on the plan. if you really look at your employee population, not everyone's needs are the same when it comes to using health insurance, dental insurance, vision, disability, life insurance. We can even put in pet insurance when it comes to these exchange platforms. So now what we're able to do is, as working with the employee, which we can do in a number of ways, we can work on a one-on-one basis where we actually would have an enrollment team work with that employee to discuss, well, how are you currently using your health insurance? What is the health of yourself or any of your dependents that would be going on this plan? And it opens up to allow the employees to have more choice and more decision in what plan are they choosing for themselves. Usually what is happening is the employer picks the plan and then the employee has no other choice unless there's a multiple plan choice in the offering. Looking at how does that work into the 3-year budget? Well, now, you can actually take a look at, instead of reacting to a renewal increase, you can decide on, by looking at how your business has operated and what successes you've had throughout the year, on now how you might be able to increase that contribution. We can look at that any way throughout the year. Most employers, when they do their budget for the rest of their business expenses, it's not done on the renewal cycle of their benefits program. So by having this defined contribution option, these conversations can open up throughout the year and really be more reactive to how your business is operating, and then to waiting on to what, to waiting on to what the renewal increase might look like. Very quickly, to not stay too long on what the exchange platform looks like, I always like to talk about, a lot of employees are doing their shopping online. Think of it like an Amazon shopping experience, to use that for an example. When they're looking on shopping online, we can also offer a Ben admin system, a benefit administration system that looks like that type of shopping experience, and the employee would be able to go on, see what their benefits are offered. They'd see what the employer contribution would be, and as they select their benefits and put them into that shopping cart, if we stick with the Amazon experience, they'll be able to see of what their costs would be or their employee contribution to purchase those benefits. So going back and stopping there with the defined contribution or exchange platform strategy, it can be done on a one-on-one basis with an enrollment team. We can do group meetings to explain that process, and then also we can talk further depending on how savvy your employees are when it comes to online activities, and we can offer what is called a Ben admin system, a benefit administration system. There's also ways you can look at level funded or self-funded programs when you're looking at creative solutions. Level funded programs and self-funded is a different way of offering benefits. It's not for every employer. This really is getting into what is the risk of your employees, your employee population. That's why going back to why that risk analysis is so important. If you're looking at an employer group that has high claims, has people utilizing their plan, level funded or self-funded might not be an option. To give you a quick synopsis of what level funded and self-funded is, level funded really is looking at the claims. I mean, that is involved in any health insurance product, but the claims now are really being paid more by the employer, particularly on the self-funded basis. So when you're looking at a self-funded option, there's 3 levels to that. You have the claims utilization of your employees. You have the administrative costs for whatever insurance company you select to do what they do, even looking at a fully insured plan, paying claims, sending out explanation of benefits, processing those claims. And then you also have, lastly, the stop-loss insurance, which stop-loss insurance allows you to have a threshold to where you're not going to have to pay every claim that comes out from your employees. What the underwriter will look at is give you an aggregate amount or a cap, where once your employees would reach a claims cap where you have so many claims coming into that aggregate amount, the stop-loss insurance then would pick up the rest. On a level funded basis, it's a hybrid. It's a traditional health insurance platform. where you're going to pay a flat monthly premium every month. It still has some of the different features of a self-insured option, but instead of having a different monthly premium going throughout the months of your plan like you would with a self-insured option, the level funded option gives you that constant same premium. There's a max rate that you're going to pay. What both of them allow you to do is, particularly on the level funded option, is really now you're paying for what your employees utilize when it comes to their claims. On a fully insured option, I'm sure a lot of employers are sitting there when their renewal comes in every year and saying, I don't think we used our plan this much. Why are we getting this high increase? Well, on these level funded options or self-funded insurance options, you're truly paying as the claims come in. And if you perform well throughout the year, particularly on the level funded basis program, you could receive money back at the end of the year because your employees have not used the amount of premium you have paid on a monthly basis compared to the claims that were actually endured throughout the year. So that was really a 30,000-foot explanation. We've had other webinars explaining those two funding arrangements. I know that we're going to have some other ones coming up here in the future. So if you are confused a little bit about that, I apologize. I don't want to go in too much detail today, but really looking at those two options, it's really getting at to the risk analysis, seeing if you are a group that qualifies for those type of options, and then it does involve a little more when it comes to looking at the way that you are involved as an employer on the claims that are paid throughout the year. Looking into incentive-based insurance, because we're getting short on time, I want to skim over these. I've taken a little too long on the first two options. I do apologize for that. But incentive-based insurance really gets into looking at the health of your employees, developing some type of well-being or wellness program, and then as your employees participate in a well-being program or looking at the health of your individuals, you as an employer could provide an incentive for them to, one, participate in the well-being or wellness program, or two, you could provide the incentive based on just their health. So very quickly to explain that is if you had a well-being program in place or a wellness program in place, and you did some type of measure of an employee's health, a popular one is biometric screenings. You can then have an employee pay less in an employer contribution, or if you have a health reimbursement account, you could have them pay less than what they have to pay towards the deductible of that health reimbursement account due to the health of that individual. What you can also do is we can set up for your, as a broker, we can set up with you very easily attained parameters to where, let's say the employee is not meeting the parameters of your well-being program or your wellness program, but we develop a health coach that gets them through that to get to the level where they can have the highest contribution from the employer. We would set up small goals to get them to maybe talk to a health coach or go to have their physical done for their yearly physical exam. Or maybe they're not taking their maintenance prescription drugs and we have the health coach get them to start taking their maintenance drugs. Well, as they go through and they meet those qualifications of your well-being program or wellness program, their contribution would then be less toward their monthly premium, or again, if there's some type of deductible strategy where the employer is paying something towards that and the employee also has responsibility, maybe because they have met all the goals and what they need to do to get to those levels, that's when their contributions would be less. So to sum that up, you're providing some type of incentive for your employees to get at their health, to then for the reward, what they would have a less of a contribution on a monthly basis for their premium, or a less of a contribution for their deductible that they have. Going into gap insurance is a way that you can provide deductible relief. It's not a new program whatsoever, but what we have found at JRG Advisors is we do have some gap options that truly what I like to call cover the gaps in the gap. So what you are able to do is this would be a separate product we can put in place for those employers that are now at that time where they're into the very high deductible stage. Their premium, due to the health of their employees, is causing to offer these very high deductibles that particularly here in the tri-state area that we're not accustomed to as employers offering. So the gap policy would pick up those deductible expenses for becoming sick, becoming injured, diagnostic testing such as blood work, x-rays, MRIs. And some of these plans can essentially get you down as an employer to a first dollar coverage plan or a very low deductible plan by putting the gap policy in place to overcome the very high deductible that you have with the medical policy. If you would just stick with the medical policy, then it would be too much for an employee to endure those out-of-pocket costs. The gap policy can provide some relief to those costs. And then lastly, for creative solutions is voluntary benefits. Everyone's very familiar with voluntary benefits, but a lot of brokers don't use that to help eliminate some of these high out-of-pocket costs. So if a person, we all know what voluntary benefits look like as far as accident policies, critical illness, cancer, these are ways to offer these benefits which do not cost the employer any money. But if the employee becomes sick or injured, it's a product that will help eliminate those high out-of-pocket costs. So going into the consulting and service implementation of the 4 C's approach, what I think we always have fallen down in the past as operating, again, going back to just as an agent and not as a broker consultant, so we try to shove a consulting or service process into every group. It's important to go through customization or customizing the consulting process or the service implementation that you have with each employer group. Not every employer has the same needs when it comes to the service that is needed with the employer's administration team, their HR department, or the one person that in most cases is handling the employee benefits for the company, or when it comes to the service that employees are being offered. You have to look at innovation when looking at consulting and service implementation. What do I mean by innovation? Well, when working with an employer group, it's very important for a consultant or a service representative to provide different strategies throughout the year to help keep that benefits program on pace. That can be different software programs where we're providing predictive modeling throughout the year to tell you where your renewal increase is looking at ahead of time. You know, maybe we do that on a quarterly basis where if you're a larger group, we're sitting down and we're reviewing the claims utilization on a quarterly basis, semi-annually, to make sure that you're not surprised when it comes to, that renewal increase. That time where, every HR director or whoever the benefits administrator for the company just dreads on coming that because you're kind of blindsided with that. So providing some of these innovative ways with software programs, customizing the service strategy to where we're meeting the needs of the employer and the employees is very important when you're looking at the 4 C's approach to a benefits program. What that involves is setting up the proper teams to handle those strategies. At JRG Advisors, what we do is we have a client advisor team that works with the employer's admin team, the HR department, that one individual handling the benefits. And that client advisor is responsible to meet throughout the year to talk about how's the benefits strategy going, how's the service been so far, keep them updated on what's going on in our industry. We've talked about some, at length probably, some of the creative solutions that can be offered to offering a benefits program. Well, that really causes a lot more work throughout the year. That shouldn't be on the employer. The broker should be doing that. The consultant should be doing that. So having a client advisor team to work with the admin team at the group is very important to keep on pace to what the strategy is. We find a lot that employees are coming to an HR department coming to that benefits administrator at the group for a lot of questions. It's taking away from that person at the company, the benefits administrator or the HR director that wears a lot of hats, taken away from their normal day-to-day duties. What we have at JRG Advisors is a client resource center. And that client resource center is there to answer your employees' questions. We always, in the past, have driven a lot of brokers at JRG. We haven't done this, but have driven those employees to the insurance company. Well, that's not an easy process for an individual. It's a lot of automated systems where they're hitting numbers to try to get to the right department. At JRG Advisors, you get a live person. Your client resource center representative can simply ask what the question is of the employee, and then it's our responsibility to go to the insurance companies and get that answer for that individual. It takes time away from the employer to not have to go and do that for the employees. It also is very important to keep in mind of PHI, personal health information. You want to stay away from that. So our individuals are licensed to handle those questions and go to the insurance companies to get those answers. And then also because of the changes that we've had with the Affordable Care Act, with ERISA, which takes us into our next slide, and really the fourth part of the 4C strategy, is it's very important for an employer to have some type of compliance team when working with a broker consultant. We all know what's going on in the news today. We're still not sure what's going to happen with the Affordable Care Act. And as the Affordable Care Act has been rolled throughout the last couple of years, rolled out, I should say, through the last couple of years, there's been constant changes with that. It's important to have a compliance officer, which we do here at JRG Advisors, and a compliance team to work with that employer to make sure that they are abiding by the rules and regulations of the Affordable Care Act. Something that's not new, goes back all the way, I believe, to 1974, is ERISA. There's a lot of different parts to ERISA. A lot of rules and regulations that are required by an employer group to stay compliant. The goal of a compliance team is to make sure that if you ever have that knock on a door by the Department of Labor, where they're going to come and audit you and make sure that you are in compliance when it comes to these regulations. Our goal at JRG Advisors is to make sure that you can just hand them a file and everything is in compliance. You're meeting the regulations of both of those Affordable Care Act and ERISA standards. And there's also a lot more involved with compliance. What we do for the 4Cs process is we would have a member of our compliance team to do a thorough review of what you're currently doing as an employer, and then we would talk to you about how we can get you in line to the rules and regulations due to your group size, the benefits that you're offering. It goes into health savings account regulations, flexible spending accounts, HRAs. I try to stay a little bit away from when it comes to compliance and let our compliance team handle that when it comes to what we do with our employer groups. So I know that was a lot to really fit into our 30-minute segment. I've gone over a little bit, so I'm going to really conclude and close with adapting to the change. I find that, a lot of times brokers will give a lot of ideas. Sometimes to a fault, we do a benefits dump and tell you everything that, we do at our firms. But at JRG Advisors, what we really like to close up with is letting you know, what is it going to mean? How can you adapt to the change that's going to happen here? We've gone through our 4Cs approach, and we found through that approach that you really are looking at some holes within your benefits program that you would really like to talk about changing, maybe instituting some of the creative solutions I skimmed through. Maybe looking at the compliance aspect of it. The consulting services, you're lacking in that. You're finding that your current insurance agent is doing that, being an agent, not having a strategy throughout the year when it comes to service and consulting. And then lastly, getting at that cost, implementing those creative solutions to develop that 3-year budget. Well, what we need to do to get started is we have to have a discovery. We have to sit down with you as an employer, ask the appropriate questions, listen to what your goals are, what you're currently going through when it comes to your benefit strategy, and discover where we can fit some of these different parts of the 4C strategy or all of them into your benefits program. We have to establish goals as your broker. We listen through the discovery phase of what your goals are as an employer, but as your broker, we need to make sure that we're meeting your goals of us. So what our consulting and service team will do is establish goals to meet throughout the year. Establish goals through the implementation of this 4C approach to keep us on track, to make sure that we come to the end result that you're looking for as the employer. It'll take on both parts to implement that strategy. This is something that's not done overnight. We have to make sure that we stick to the goals and implement that strategy throughout the year to make sure you're having the best experience. One quick example I can give you is the renewal process. I find that sticking to that old way of operating as a quote-unquote insurance agent, I'm sure a lot of us on the call today have been there where you've come to your renewal date and you're past it now because you haven't implemented your strategy yet. Your broker was late to the table in bringing you some of these solutions. It's important that we establish how we're going to implement that strategy to keep on pace, to not go back to having you, just have an overall bad experience when it comes to your benefits program. And I think most importantly, it has to be an open dialogue throughout the year. The broker consultant has to stay in front of the employer throughout the year to make sure that the strategy we've implemented is staying on task. We've established the goals. We're meeting those goals throughout the year. And as I go back to, when we talked about, the ever-changing atmosphere we have when it comes to the Affordable Care Act and the regulations that come with meeting compliance, it's happening with product solutions. It's happening with different innovative ideas, different creative solutions. So it's important for a broker consultant to have that open dialogue throughout the year with the employer group on two levels, with the administration team, and also keeping the communication, the open dialogue with the employees as well. Sometimes I think we forget as brokers that the employees are the end users of a benefits program. So if we're not communicating with those employees to changes through our Client Resource Center, or sending out a newsletter throughout the year, or some emails on updates that might have happened, that's very important to keep in mind that is the end user when it comes to a benefits program. So open dialogue is important with not on the employer side, but the employee side as well. So I apologize that I went through a lot of that very quickly today. If you were confused on any of the creative solutions, please reach out to us. If it sounded like it was something of a fit to you, we can go into more detail. That was just to skim over and give an idea of what some of the creative solutions are part of that 4C strategy. With that, I guess we'll wait for some questions to come in. And what I'd like to remind everyone is we do have a 3-part series coming up for our next webinar. The first part of that 3-part series is on Thursday, July 13th at 10 a.m. It will deal with risk analysis, understanding health conditions and costs within your workforce to reduce future costs. The second part would be on Thursday, August 10th at 10 a.m. That will involve employee contribution strategies, reduced employer expense and increased employee take-home pay, for example, FSA, HRA, HSAs. And then lastly, the third part of that series will be on Thursday, September 14th at 10 a.m., and that will deal with healthcare cost transparency. So to sign up for the 3-part, first thing you're going to want to do is to sign up for the first one on Thursday, July 13th at 10 a.m. to get started.
Okay, Mike, the first question, my company provides 70% premium paid by the employer for individuals, families, or husband-wife coverage. Is this a typical contribution strategy, or do most companies define a contribution at a flat dollar amount?
Sure, that's a great question, and really, you're probably not going to like my answer because really it's both. Traditionally, what we have found is a lot of employers do stick to that percentage of premium strategy. For this question example, 70% of the premium being paid by the employer and the rest being picked up on the employees. But what we have found to make it easier to get away from the employer on having too much of a decision in what they're offering in benefits is we're breaking it down to that flat dollar amount or that defined contribution. It provides the employee a little bit more of an ease when it comes to understanding what their contribution is for their medical benefits. But really, there's no right answer to that question. It's really up to the employer and what they're comfortable in doing. I will say that if you're looking at providing an exchange platform where you're getting away from picking products for employees and allowing your employees to have more choice into selecting their benefits that fit their needs or their dependents' needs, that flat dollar amount contribution is the easiest way to have that strategy. So I think it really goes down to on what is your benefit strategy on how you're providing your benefits, and that's when it will come into deciding on what the best strategy is for your employer contribution to the premium.
Okay, the next question. Our company implemented gap insurance last year with our employee benefits plan through JRG. It worked really well and reduced our premium.
So I think that's just a comment. I appreciate that comment. Yeah, that has become a very successful strategy, particularly if you're an employer group, as I mentioned throughout the webinar, that if you're getting to that point where you're at a $5,000 individual deductible, $10,000 individual deductible, and even though you're offering benefits, it's unaffordable because of the product you're offering, that gap strategy is a real good strategy.
The next question, if I want to meet with JRG specifically to talk about compliance, what number do I call and who do I ask to talk to? Sure.
For compliance questions or just wanting a review, the number that you would reach at JRG Advisors is our 800 number, which is 1-800-556-4699. And when you do get someone on the phone at JRG, because we always have a live person answering that phone, Frances Horn at JRG Advisors heads up our compliance department, and she would be able to guide you with any compliance questions you might have.
The next question, when you send out the summary of today's information, can you include a sample of an employee newsletter that you create for clients?
Sure, that's not a problem. We have several clients that take advantage of that service that we offer, so we'd be more than happy to send out an example newsletter.
That's the end of our questions for today.
All right, well, I appreciate everyone and thank you for participating in our webinar today. If you have any questions or would like to learn more, please contact us at 1-800-556-4699. Thank you.